Okay, welcome to the live stream from Duke Spine Institute. We're going to give you a little numbing medicine. Our patient's back is here, you can see it, and he is coming to Duke Spine Institute from
St. George, Nevada. St. George, Utah. Not Nevada, Utah.
from Utah. And he has a lot of stuff going on, but one of the issues is he has two herniated discs in his lower back, one at L3-4, another at L4-5. And the one at 3-4 is on the left, everybody agrees, and the one at 4-5 is on the right. We're on the left side, so we are doing the proper level. I'm giving him a little more numbing medicine to make him feel better. But basically, the surgery is being done for degenerated disc, herniated disc, bulging disc. You name it, we can do it. 5, 4, 3. I would move the fluoro north a smidgen. Shot. All right. Got a pretty good trajectory there. I say we could start a little bit higher. Shot. That's nice. Getting around the facet. Perfect. Shot. So that is 3-4 that I'm aiming for. Shot. And Jordan will count. Shot. All right. Jordan, you want to count for us? Show us the sacrum at the bottom. Sacrum, 5, 4, 3. So we're supposed to do 3, 4 on the left, and we've done that. Now we're going to go to the right side and do 4, 5. And the reason we're going on both sides, this patient has pain on both sides in his legs. When people have just back pain from a disc, I can usually go on the same side to fix it. Yeah. But when they have pain, that's enough. When they have pain on both sides in their legs, I have to go on both sides. The side of the leg symptoms determines the side that I go, usually. Shot? Alrighty then. Shot? You can see he's got arthritis in his facet joints as well. You all see that? Shot? Show us the facet joints.
Yes, we do.
All right, take a look at the facet joints. There's one, that's L4-5. Look how dark the bone is. It's dark. Show 5-1. Look how dark the facet at 5-1 is. Okay, very dark. Go up and show us 2-3. Look at 2-3, how light it is. The reason the bone is darker at those lower facets is arthritis. Okay? AP, arthritis in the joint causes the bone to react and become stronger, thicker. It actually stabilizes the joint. The whole process of arthritis is to stabilize a joint and make the joint stronger. All right, we're about ready for him to participate. Dr. Berndes, let me know when you're ready. Shot. Are you comfortable? About as comfortable as you can if you're having needles stuck in your back. All right, go ahead. Are you comfy? Can you hear me? So when he came to me and we did our telemed, I asked him, where is your back pain? And he showed it to me. He said it was in this area right here. Okay? And I knew this area is like the L3-4, L4-5, L5-S1. So then I discovered that his pain was very central at 3-4 and 4-5. However, he also had pain on the sides here. And this is your facets over here off to the sides. And he had bilateral facet pain and tenderness when you pushed on him. So I knew we had to deal with both the facets and the disc. Are you comfy? Is he reliable? You're doing great. Lay still. How bad is that? Huh? when I just injected? Yeah? So we got a little ways to go. Shot. He's got 2 tears. Let's just go ahead and keep him down. We're just gonna, yeah. We'll just do the discogram showed tears, but we're not gonna get a recording because he's too, yeah. And I'm fine with that. So, yeah, we want to keep him comfortable. So we're going to do these 2 discs, and then we're going to do the facets. All right, this whole thing is done with a small incision. It's outpatient surgery for those of you who've never seen this done before. Yeah. Shot? Outpatient means no hospital, no overnight stay. It's all done in one day. And as a matter of fact, it's an hour surgery and an hour recovery. And then he's going to go back, not home because he's from Utah, but he's going to go back to his hotel. He'll spend the night and then come in tomorrow, and we'll check him up, and then he can go home, back to Utah. Now, I can tell you he is having other procedures done, and I don't want to go into a lot of detail, but we are going to be working on other body parts with him. So I don't know if we're going to be broadcasting the other surgeries. Shot. Shot. All right, we are inside that disc at 3-4, and then it's definitely a painful disc because we could tell his heart rate went up when we injected it. Now the whole surgery is going to be done through these tubes. The same tube. It's a tubular retractor. These are all FDA approved. We don't do anything without FDA approval of our equipment. Shot. Shot. Beautiful. So we're inside the disc. Specifically, we're within the annular tear. Shot out. At this point, we've got our tube placed, and we're going to move forward with the endoscopic part. Where's the blue towels? Feel free to ask questions while I'm doing surgery. If there's no questions, Sanjay, why don't you show the audience our video explaining how the Duke laser disc repair, or actually how the disc can cause so much back pain. Let's start with that one.
Copy that.
Meanwhile, I'm going to pull out some herniations.
Duke Laser Disc Repair, a comparison with traditional spinal fusion surgery. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs.
All right, welcome back.
My wife was here today because of it. She's having coffee. She can't see me coming out.
Really?
She saw it all fine. It was in an episode. But my son was smart. He was 60 feet away from the pedestrian traffic because if they're going to a football game at ASU,
Uh-huh.
going there for an interview, the dean gave him a bunch of free tickets for us to go to.
We have a question from HPK on YouTube.
All right, let's hear the question.
He asks, is that methylene blue or contrast agent?
Is that methylene blue or what?
Contrast agent.
The blue color.
Yes.
Are they asking about the blue color? It's not methylene blue. It's Duke Spine Blue. It's Duke Spine Blue. As a matter of fact, I'll tell you, it's 450 nanometers is the wavelength of the light you see in this dye. It's specifically known as royal blue. Royal blue color. And that's the color of Duke Spine and Duke Joint Institute. Royal blue. It's not methylene blue. And the contrast dye you can see on the x-ray, but you can't see it. It's clear. It has a clear color. So you won't see it visibly with visible light. You'll just see it on the x-ray. It looks like these lenses are warping. Wouldn't you agree? A little? Unless you think it's just some schmutz. Just about done here. Then we're going to go to the other side and do the other disc. This is the left L3-4. The next one is the right L4-5. Everyone agrees? When we did the discogram, the patient's heart rate jumped 30 points. I'm sorry, heart rate or blood pressure? Heart rate went up 34 points just during the discogram. And he was asleep. So what does that tell you, folks? It tells you that pain is, there's subconscious pain, that somatic afferents. Why is that happening? Huh? Somatic afferents from the disc, specifically the sinovertebral nerve, travel up to the brain. They go to conscious centers of the brain, like the primary somatosensory cortex we've talked about before, where you have localized pain, and then you have association areas that it's projected to. But those pain signals, oh, look at that herniation. They also go to the brainstem, which are subcortical areas. You don't consciously feel them, but your heart rate is controlled by the brainstem. Your breathing is controlled by the brainstem. I wonder if he had a change in respirations too. With the discogram? 9 to 12. So his breathing increased as well as his heart rate. Yeah, Dr. Berndes said when we did the discogram on him, we had a spike right away when I pressurized the disc of 34 points on heart rate, and respirations went from 9 to 12. So clearly he was in pain with the discogram, even though he didn't move his body consciously.
So those are catecholinergic stimulated fight or flight responses. They increase oxygenation, increase ventilation, and increase cardiac output. So it's a healthy run because the titer is high. That's the fight or flight response.
Well, yes, but I mean, that was an immediate response. If they're mediated through the adrenal glands, there would be a delay. right? There'd be a catecholamine surge, but it would still take some time. It would take a minute. Yeah, but it has to circulate. That response was immediate. That's neural mediated through the brainstem. The nervous system is the fastest system in the body, faster than the endocrine or exocrine systems. The nervous system communicates information faster than any other part of your body. All right.
We have a question from Neil Othman on Facebook.
Yep.
Is chymopapane injections discontinued? How did it help? Did it dissolve and resolve the herniation discs?
I could not understand what you said, Sanjay. Can you try to repeat the question?
Is chymopapane injections discontinued?
I heard chymopapane injections, and then what was the question about them?
Is it discontinued?
No. Chymopapane is no longer done in the United States. It was done for years, and there were some good results, but the problem was there was these complications. People would get something called transverse myelitis, where their spinal cord would be damaged after. Nobody knew why, but the FDA said no more. We can't do that anymore. Transverse myelitis is permanent paralysis, and they thought that the chymopapane was the reason for it. So the FDA pulled the approval from it to be injected. God damn it. So nobody does chymopapane injection anymore. No one I know.
Remember, we studied about it at medical school.
Yeah. Comes from a papaya.
Right. An enzyme.
Yeah. Enzyme from a papaya.
Bromelain comes from a pineapple.
The point is, they stopped doing that back in the 70s, I think. 70s or 80s. I never did chymopapane. I wouldn't recommend it.
Laser's much safer.
This is a much better surgery.
Lights on, please. Thank you.
We don't get transverse myelitis. Is the scope off? Thank you. Good question, though. So yeah, chymopapane is no longer done. And we stopped doing it many years ago as a medical profession in the United States. The doctors who I've talked to with the generation before me that did it, they said it worked wonders, but people were getting paralyzed. This surgery, we don't paralyze anybody. As a matter of fact, we did this surgery 4 weeks ago on a 15-year-old boy from Seattle, Washington, who was paralyzed in his legs. And now he's walking. His mother just sent me a video of him walking to the car. He's not 100% normal, but he's almost completely normal. Much better than when he came, he couldn't even walk. So, the Duke laser disc repair is a safe and effective treatment for back pain from a herniated or bulging disc and radiculopathy. Back pain, radiculopathy, anything to do with back pain or a disc problem. Shot? All right, moving on to L4-5. I need you to move north a little bit. Incision. I need the knife. Great questions. Keep them coming. Injection. Shot. I told you guys earlier today we did our first hip patient with Duke plasma rhizotomy yesterday. We basically deadened the pain nerves to her joint on her right hip. It took 1 hour for the whole surgery. In the future it'll be faster, 30 minutes. But her pain in her hip was 100% gone today when she came in. She had no hip pain anymore. She'd had hip pain for years, 15 years. She was told she needed a hip replacement, but she didn't want it. So she came to us and we did the Duke plasma rhizotomy on her hip. Shot. No metal, no fusion, just good old-fashioned American ingenuity. You know, America used to be known for more than just TikTok videos. We used to actually be leaders and pioneers in medicine, engineering, business. Unfortunately, we've lost our edge because everybody wants to be a YouTuber. And I'm going to tell you a prediction. With all these digital creators creating digital content like humans that look real, women with perfect bodies, you can't even tell if they're real or not. All these kids that are making videos and making money, whether it's on YouTube or what's that site called? Personal, that one where you get to watch naked women, men. OnlyFans. All those OnlyFans accounts are all going to be one day digital. Okay? Digital. And the only people who are going to be making money are going to be the digital creators, the digital artists. As a matter of fact, it's giving me an idea. I'm just kidding. But real people are going to get cut out. So all I can tell you is this generation of kids that think they're going to be YouTube millionaires, Instagram millionaires, they better start reading their science and math books. Damn right. Predict the future.
Or their finance books.
Finance would be fine too. But look what progress in medicine can be achieved. I mean, we achieved this here at Duke Spine in this century. You know? Basically, healthcare was at an impasse for back pain. Nobody knows what to do. Doctors are so stumped by what causes back pain, they're calling it fibromyalgia. Like, what is fibromyalgia? Incurable back pain. There is no cure. There's no such thing as fibromyalgia, folks. It doesn't really exist. If you've been diagnosed with fibromyalgia, I give you a challenge. Do the free MRI review at Duke Spine. We will diagnose your cause of back pain. And more importantly, we can cure it and get rid of it in an hour. So fibromyalgia is no longer something that's real. I declare fibromyalgia to be non-existent today. Prove me wrong. I know I'm going to get a lot of hate mail for that one, but it's the truth. In 26 years, I haven't seen a single fibromyalgia patient. Every patient that comes to my clinic with back pain, neck pain, thoracic pain, we've discovered the cause and we've given a solution that's cured it. The ones that want it. But never have I said, oh yeah, you have fibromyalgia. We don't know where this pain's coming from. It's not fixable. Too much misinformation, yes. We got 5 minutes on this disc and then we're going to go to the facets.
We got a question from Andres on YouTube.
Sure.
Hello, doctor.
Hello.
In case of a
Hold on a second. Can you guys see the tear there? The blue tear? So the blue is staining the herniated nucleus inside the tear. This is called the interposed herniation. Interposed, because it's located within the two torn halves of the annular fibers. It's stuck in there. Stuck from inflammation. Sorry, please proceed, Sanjay.
Yes, thank you. In case of a herniated disc with spondylitis, after fixing it with DLDR, is there any chance of reherniation due to
Yeah.
the spondylitis condition?
Okay, I didn't hear everything, but what I heard was herniated disc, clear it up. Is there any chance of reherniation? Yes, 100% you can reherniate. If you get this surgery done, and then the next day you go play football or soccer, or you lift heavy weights in the gym, you will reherniate. There's no doubt about it. You must give it time to heal. Okay? And the disc takes a long time to heal because there's very little blood supply. The disc does not have much blood. It has no blood. It's called avascular. There are only a few tissues in the human body that have no blood supply. The disc is one, and the lens of the eye is another. I don't think there's any other, is there? Every other tissue has a blood supply. The reason the lens doesn't have a blood supply is because if you had blood vessels in your lens, you wouldn't be able to see things. You just see blood vessels instead of people and places. You'd be driving along the street and you'd see red things called blood vessels. So the lens is clear. It has no blood supply. It has no blood. The only other tissue in your body that has no blood supply is the annulus. The nucleus pulposus, and the annulus. The inner half of the annulus. The outer half has blood supply. Okay? So why is it that the human being has only two tissues with no blood supply? I'll tell you why. The nucleus pulposus should not ever have blood supply because it is so toxic to the inflammatory system. It elicits a massive inflammatory response. So your body never wants the inflammatory system to see the nucleus pulposus, the blue stuff here. Therefore, it hides it inside your disc. Your disc is not really a cushion, it's a prison. A prison for the nucleus pulposus. Nobody knows that. I discovered that. And the reason it's a prison is because the nucleus material is so toxic. It causes so much inflammation. They've done studies where they took the nucleus pulposus out of these rats and they put it on their skin, and it created massive inflammatory response, like bleach. So the nucleus pulposus is very, very agitating to the body. That's why it's hidden in the middle of your disc, hidden away from your inflammatory system by the annulus fibrosus, which, remember, the inner half of the annulus has no blood vessels, so there's no inflammation. So what happens is when you get a herniated disc, you get a tear in the annulus wall, and it lets the herniation come out, for the nucleus come out. And when the nucleus comes out and it starts to interact in the outer half of the annulus, that's when it engages the blood supply. That's when the inflammation starts. That's when the back pain starts. That's what all these people are suffering from, millions and millions. We discovered this at Duke Spine. And now we go in and we clean the tear with the laser, and it takes the pain away permanently. But we're the only center in the world doing this. Someday it'll be done all over the world. But right now, in 2023, it's just here in Florida. This herniation at 4-5 is newer compared to the last one. The last one had more scar tissue. This here is scar tissue, but the last one was almost all scar tissue. This one is more the soft blue herniation. You see it? Yes, no problem. Almost done. We have a little bit more of the tear right here and we're finished. Okay, why don't you show the video, Sanjay, of how the Duke laser disc repair works?
Copy that.
All right, now you understand how the Duke laser disc repair works. We've just completed our second disc. We're going to move on to do the Duke plasma rhizotomy next. The Duke laser disc repair is done with a laser. The Duke plasma rhizotomy is done with plasma. Plasma is a high energy vapor. People don't understand what plasma is. If you're a physicist, you know what it is. Basically, when you convert a solid into a gas by adding massive energy, you create a vapor that's high energy charged particles. In this case, electrons. That's why we call it the Duke plasma rhizotomy. You've probably seen plasma before. You remember those old toys that you could buy and they had the electrical arcing stuff, the gases? At least they were popular when I was a kid. All right, let's get started. We're doing 3, 4, 4, 5, 5, 1. Everyone agree? Shot? Oh my God, Jordan, look at that. But that's 4. So I need to get to the one above. All right, shot? That's it?
Yes, sir.
Oh my gosh, dude. Go ahead. What do you say to that, George?
Like darts. Hit the bullseye.
Without even X-ray vision. Needle. So what we're laughing about is I was able to place the needle exactly on the spot it's supposed to go, where we want to target. And I did that without even the X-ray. Now, of course, I'm going to use the X-ray because you don't know for sure if you're in the right place unless you use the X-ray. Shot? All right, heading to the right spot. Now what we're targeting here is simply the area where the nerves are. Shot? So if you look at where the tip of that blade is, it's exactly where the pain nerve runs. Yeah, and that's what I'm targeting. Let's see where we are. Yep, so right in that spot is what you want to target. Perfect. That was L3. Now we're going to go to L4. I gotta use my x-ray to see where we are. Too high. Shot. Too high. Shot. Better. Once again, I'm targeting the valley. All right, that's 2 down. 2 more to go. I did number 3 and number 4. We're going to do 5 and S1. Shot. All right, a little high. Show us the targets, Jordan, for the benefit of the audience. Shot. Yep, too low. Perfect. Shot. Num num. I could feel the bone. That's exactly the most perfect spot right there. The reason we're giving some num num there is we want the patient not to hurt so much. Show us the arthritic facet there. Look at those facets, guys and gals. They are massively damaged. They're all dark. See how dark they are? That's all extra bone. They should not be that dark. They should be a third of much bone.
Is that called exostosis?
No, that's called facet arthropathy or hypertrophy. Specifically, facet sclerosis. Shot. 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 All right, that's pretty much perfect. The key is I gotta stay right on that bone. Shot. I moved. Uno más. This is the last one. Shot. We need to get down a little more lateral. Shot. To inferior. Shot. Yeah, go ahead, Luis. Oh, any questions?
No current questions.
Shot. To inferior. Shot. That's the perfect spot right there. Remember, you got to feel bone. If you don't feel bone, you're not deep enough. If you're not deep enough, you are not going to get the nerve. Shot. You got to be literally on the bone. I feel the bone now. So don't settle for not feeling the bone with the tip of your probe. Always feel the bone with the tip of your probe. Want me to switch? Let's switch so you can do the other side. That's it for this side. We've done 4 nerves, pain nerves, all of them medial branch of the dorsal ramus. My team has done a great job. What's the next patient?
DLDR, 2 levels, 1 less, right?
2 level DLDR. I don't think that doesn't have a DPR, right?
Shot.
Straight DLDR. 2 levels.
I was on a roll, so 5, 4, 3. I need to be a little bit higher. I was on the roll. Watch your hands. And that should be it. Shot. That's it. Go ahead. Any questions?
No current questions.
Thank you. Well, the audience has been lovely. Our patient, I think, is going to be very happy with the amount of pain relief he gets from Duke Spine Institute that only Duke Spine Institute can give. Are we at 40?
Yes, sir.
Oh well. A lot of fascia. Shot. 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 So I'm trying to find the transverse process here. I'm playing around a little bit. I think I'm just north of it. Shot. Now I'm south. I just gotta find the happy. Don't move that right now. Shot. I think that's really good. Shot. Let's see where that is. It's a little bit south. That's good. Shot. It's too south. Shot. That's good. You see how hypoplastic that TP is? It's small. You know what I mean? Mm-hmm. There we go. Shot. Compared to the other ones, which are much bigger. This one is small. Hypoplastic means small compared to what it should be when it comes to bones or other organs. Oh my gosh, just perfect. And 2 more to go, we'll be done. How's he doing? Shot? What?
Have another one, please.
Let me see. Just cut that off, we're fine. Shot? Shot? That should be good right there. Shot? Num num. Needle is there. Last 2, but last incision. Remember the other day? We had some fun.
Oh,
Huh?
Yeah.
Everything's okay. Well, that's too low. Let me have it. Shot. Shot. It's pretty good there. Shot. It's too low. Shot. That's more like it. A lot of scar tissue, I can feel it all. Shot. Oh my gosh, it is so bad in there. All right. Last one. Yeah, let's get another tip.
Can I have another tip, please? Volunteer? Thank you.
You done with the staples on this side? There's one more here. Go ahead and finish that. Give it to me. Hold pressure here. Actually, you can whittle away. Here. You ready?
Yes, sir.
Shot. Oh, way too low. Shot. Too low. Shot. 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 There we go. It's more like it. This pelvis is very abnormal here. There's some rotation, like some scoliosis.
He said he had that after the accident.
Hmm.
He called the ship.
Yeah. Shot, definitely. I can tell. Because his left side is far deeper than the right. Shot. Too low. Shot. Too low. Shot. Shot. 10 seconds. Yeah. You can feel all the arthritis. Done, right?
Yes, yeah, yeah. Thank you. Lights on, please. Thank you.
Good job, everyone. All right. Any questions, Sanjay?
No questions?
You can end the broadcast.
Copy that.